Good day, ladies and gentlemen. Thank you so much for joining me on this edition of the program You're Held on Equinoxe Radio Multimedia. Today, we'll be navigating pregnancy care in Cameroon. And in this country, pregnancy is a time of great joy, but also of great risk. Every year, hundreds of women die while trying to bring life into the world. The maternal mortality rate is alarmingly high, with many of these deaths occurring due to preventable causes. Today's health expert and I will be exploring the journey of pregnancy care in Cameroon while highlighting the challenges and also the triumphs of healthcare providers. And my guest today is Reverend Dr. Glory BEFEKE ANYE. She is a resident in gynecology and obstetric in the Faculty of Medicine right here in the University of Douala. Good day. It's a pleasure to have you on the program today.
Good day, Immaculate, and thank you for the invitation.
Doctor, today we'll be looking at pregnancy, and most of the times while watching Cameroonian films, or let's say Nigerian films, one of the first signs we notice is that for us to conclude that a woman is pregnant is that she rushes out of the parlor and goes outside to vomit. That has always been the scenario we have always seen in films to tell us that this woman is pregnant. From a medical point of view, at what point or stage do we say this lady is pregnant?
Right. The first 3 months of pregnancy is crucial. Within this time, we have some hormones called the human chorionic gonadotrophin hormone. And this hormone is a pregnancy hormone. It comes with a lot of complications like the morning sickness you've just mentioned. Mm-hmm. It provokes vomiting. It equally expresses in terms of fatigue, because at this time, there are certain physiological changes that the woman's body is undergoing. So with the production of this hormone, it induces the lady to throw out what we call morning sickness, which is nausea and vomiting. So it's induced by this hormone. And during this period, we will advise the woman, usually that is the kind of sympathetic sign of pregnancy is normal. It's a sign that comes to announce that the body is undergoing certain changes, because now there's a foreign body, the baby, who is coming in. So the lady psychologically has to be prepared. She has to avoid, if she finds herself in this situation, it's not all women who will experience this, but the women who experience this should take meals in bits, should not eat meals, larger quantity of meals. Should take the meals like 1 to 3 hours in bits. Should avoid drinking water during the meals. Water should be consumed out of the meals. During this period, equally, we encourage the women to take some dry stuffs, like maybe dry biscuits, crackers, dry bread. And for some, ginger equally can help. A mild quantity of ginger, not much, in order to prevent this. Now, if the vomiting persists and it becomes so heavy, what we can term hyperemesis gravidarum, there it becomes pathologic. Medical consult needs to be sought. Also, there is fatigue. With this physiological change that the body is undergoing, because it's receiving a foreign body, which is the baby, there is also need for high level of blood circulation in the body. So at this level, the lady may tend to start expressing with fatigue, tiredness, because the quantity of blood in the individual tends to be shared with another individual. So at this time, we encourage the woman, when you start experiencing this fatigue, you should have enough rest, about 7 to 9 hours in a day. You should also take little naps in between the day, and also consume iron food substances like beans, meat, meals like that with a lot of iron component in it. So Immaculate, that is it with those announcing sympathetic signs of pregnancy.
And now, doctor, from the day a woman is declared pregnant, when should she start her visits?
Right. According to WHO, antenatal care contacts, good antenatal care contacts can go up to 8. They stipulate 8. Now, they expect that up to 12 weeks of the pregnancy, the woman must have done at least one there to confirm the pregnancy. Then, as from 12 weeks up to 28 weeks, we expect that the woman should be seen by his or her health professional every month. So from the 12th week to the 28th week of pregnancy, it should be a monthly antenatal contacts or visits. From 28 weeks to 36 weeks, the woman is expected to carry out these visits or these contacts every 2 weeks. Every 2 weeks. Then from 36 weeks up to delivery, it should be weekly. So a good antenatal contacts or visits should be up to 8, at least, as stipulated by the WHO.
And what exactly happens during these visits?
Right. During these visits, the health practitioner or the specialist, the gynecologist or the midwives will check the blood pressure. Now, this blood pressure check is in order to prevent, the pregnancy comes with a lot of complications as well, like hypertension. We can have hypertension induced by the pregnancy. The woman was not having high blood pressure. Suddenly, because of pregnancy, she tends to have high blood pressure. A woman who was not having diabetes, because of pregnancy, she tends to have diabetes. So the blood pressure needs to be checked. And in case of any abnormality, the woman will start to be controlled in order to prevent any preeclampsia or eclampsia. Those are heavy words. We find some women convulsing at a particular stage in pregnancy. That one, we call it eclampsia. Pre-eclampsia, we have women who express with high blood pressure, who express with some other biological signs and maybe headaches, flu vision or blood vision, epigastric. They'll start complaining of pain at the level of the right chest. So a pregnant woman who starts having those kinds of signs should quickly go in for the check. So we check the blood pressure. During these visits, we check equally for the weight, which will enable us to know whether the baby is developing well or not. Also, the fundal height. The fundal height, that is the height of the abdomen, in order to assess the better growth of the fetus. Urine is also being tested to check for any proteins. This is still related to the blood pressure. Equally, during these checks, we check the blood sugar level, as earlier stipulated, that you can contract or have diabetes because of the pregnancy, not because you were supposed to have diabetes, and many other checks within this time.
Let's focus on blood pressure. What can trigger a pregnant woman's blood pressure?
Right. The fact that the woman is pregnant, and during this pregnancy, the blood level needs to be shared to break it down so that the common man can understand. So during this period, the placenta, which now acts as the lungs for the fetus or the embryo, because when the fetus or the fetus, or let me say baby, so that the common man can understand, although in the womb we have embryo development going to fetus. So during this time, the fetus will not breathe through the lungs as you and myself do, but that is done through the placenta. So the placenta serves as the lungs or the stomach for the baby, from the mother to the baby, and the baby, the waste products are taken back, like carbon dioxide, other toxic waste products from the fetus back to the mother for purification, and that cycles go on. So during this, there's a period like 8 weeks, within 8 weeks of pregnancy, where the placenta starts developing, and there is this trophoblastic invasion. Invasion means that this activity tends to be implanted. The baby, like the umbilical cord, tends to be inserted in the placenta, which connects the fetus with the mother. And during this period, there may be some abnormality. Some abnormality can occur where the insertion or the trophoblastic implantation goes wrong. In this way, it triggers this blood pressure to be elevated. And you start having signs like serious headache, blurred vision, epigastric pain, especially to the left side at the level of the liver. In the urine, you do a urine test, you can start having proteins in the urine. So these are some of the things that can trigger malformations. Also the environment, you can have environmental factors. Stress can also trigger. We can equally have a consumption, maybe we'll reach there, the consumption of certain unprescribed medications that can be teratogenic, and it can induce that situation, and this lady can start having more manifest with the blood pressure.
Let's go now to weight gain. We have a lot of pregnant women, or let's say women, while they are being pregnant, they tend to eat a lot. And they claim it's because the baby's asking, or let's say they're eating for two, as they normally say in our normal parlance at home. While being pregnant, should your portion of food change?
Being pregnant, the portion of food should, well, before I go to should it change, the pregnancy hormones will induce the eating habit for the woman. For instance, the morning sickness. For some, this vomiting may persist. There, the woman will have loss of appetite. She will eat less than she had been eating because of this pregnancy. Now, for those with appetite, they should eat, but eat in a regulatory manner. And this is where the antenatal visits, the importance of the antenatal visits or antenatal contacts come in. In a way that each contact, this woman is evaluated and assessed. If she is found to be gaining a lot of weight to the term of pregnancy, she will be cautioned and advised to eat well, to carry out physical activities in order to avoid big babies, too much big babies, because now if your baby is too big, that cannot get into the pelvic brim in order for it to descend to be delivered vaginally, the end result will be a cesarean section, which most people will not want. So in order to avoid some of these issues, do